all protocol duly observed ukuze kungongela isikhathi. Ithuba elinjengaleli ithuba eliyinqayizivele ukuba umuntu aveze ukuthi iliphi iqhaza elibanjwa nelingabanjwa abaholi bezikamoya noma bezikalizwe. Esikhathini esiningi kuba sengathi bangabantu abasesayidini lokwemukela okuhle okuza kubona. Uma ngithola ithuba elinjengaleli angikwazi ukudlula ekutheni ngingasho ukuthi abafundisi balesi sikhathi bangabafundisi abahlukile kunabafundisi bama decades ambalwa adlule. Information ekhona for public consumption abantu abayithukisayo manje abasafani. Ngakho ke uma kukhulunywa ngendaba ye mental health, I was privileged nami ukuthi ngithole an international organization eyayihamba eAfrica ibheka focusing on the East Africa ibheka kakhulu ama issues of mental health. That is where I learned ukuthi it is a wrong approach to begin to approach or to treat matters of health from the illness part of it. Kufanele siqale with preventative measures by making sure ukuthi abantu ba aware ukuthi what is mental health, so that bakwazi ukuphila ngendlela eyenza bangafinyeleli la sebe categorizewa khona njengabantu abanye asebengama users ezinto ezikwazi ukubalekelela ukuthi bakwazi ukusustain impilo. Angiphuthume nje ngithi uma thina as faith-based organization si approacha indaba yomqondo noma ye mental health, siyibuka firstly from the whole person ministry ukuthi umuntu wenziwe izinhlaka ezine. Umuntu is the soul, spirit, body and social relations. Uma kukhona uhlaka olungaphili la sesiqalile ke ukuba netafula elinemlenze emithathu. Amanye lamatafula asemiswe ngezitini. Uma kumbozwe ngendwangu ngacabanga ukuthi itafula. Kubonakala mase khona ojabule kakhulu bese yama kulitafula bese liyawohloka. Iningi impilo yabantu enjalo la ngaphandle because there is imbalance. Omunye uyaphila kulezi inhlaka ezimenza abe nguye kodwa akakwazi ukuphila phakathi kwabantu. Noma abantu aphila nabo abamthathi njengomuntu ofanele ukuphila phakathi kwabo. So it's very important. Okwesibili esikwenzayo, and this cuts across, it does not mhlampe refer to Christian organizations, all faith-based organizations, because mental health is for humanity. Akekho phuma discharge. There is the awareness cycle where we take the person through ukuze sikwazi ukubona ukuthi lo muntu uyakwazini ukuzithola ukuthi ubani. One of them was informed by abantu othola ukuthi uphila kwi-abusive relationship. Uvuke ekuseni ayovula icala ukuthi ushayiwe, uma sithi siyalandela semnikeza support sihlangane naye kade siyosula icala, iblue eye sabonakala uza kude ukuthi lo muntu ubhlungu busekhona kuye nama marks abuse asekhona. Now sase siyabona ukuthi this has to do with mental health. Kusho ukuthi in the subconscious mind of the person kukhona okwashiwo kuye okumenza acabanga ukuthi the abusive relationship isho uthando is an expression of love. Ngoba whatever was planted in the subconscious mind izothela ithelo. Now we teach people how to take that and put it on the table, ukubeka etafuleni izinto owakhuliswa ngazo ukuthi mawushaywa uyathandwa, uma sewushaywa kwi relationship usathandwa na, kuthathe ukubeka etafuleni ukuhlaziye umi interpretation noma uhlaziyo lwakho luthi cha ngiyahlukunyezwa, ama emotions akho will be infected negatively, then you begin to know ukuthi ayakusahambi kahle. Kodwa ma use still happy ukuthi uyahlukunyezwa, kusho ukuthi there is something wrong with your interpretation. Yingakho ke sibona ibehavior number 4 kumuntu uthola ukuthi iyasidida sasimenze kanjani. Kodwa ke ngithathe okwesithathu, sibe sesiyamthatha umuntu mayise simthathe through that program, simbeke kwi program ye change ukuthi noma ngabe ube sekumukele ukuthi yena unje futhi akamukele wamuntu uphila ngendlela aphila ngayo, kodwa angakwazi ukushintsha abe umuntu one value nomuntu okwazi ukuphila phakathi kwabanye abantu amukeleke. Leyo ke yona inenhlaka ezinhlanu bese ngihlala phansi. Number 1 awareness. Senza show ukuthi umuntu aware ukuthi there is a problem. umese happy nganoma isiphi isimo akusona kodwa isibonayo thina njengomphakathi ukuthi akuhambi kahle, whether uphuzo olunamandla noma yini enye, kusho ukuthi lo muntu is not aware, simthatha through that awareness. Umese aware kulula ukuthi ashintshe umuntu by educating the person, simnikeze ulwazi lutholakala. That is where collaboration comes into place. La ke sesiya manje kuma departments ngoba thina we do not diagnose as mental health care workers. What we do, we assess and refer. Umuntu masimbona ukuthi unalesi simo siyamrefera either ku psychologist noma whosoever ongakwazi ukumsiza. And then uma sesimnikele lelo lwazi kuya isigabeni sesithathu whereby sizomlekelela ke manje ukummotivate, because umuntu angaba aware ukuthi iproblem ikhona, alwazi abe nalo ulwazi lokuthi kufanele enze njani, but uma engekho motivated angahlala nolwazi analo. So we motivate people. That is why we find most of the pastors, they have become motivational speakers. They are trying, not that it is the way to go, they are trying ukuthi lo muntu akaphile, but kumuntu hayi kusazolunga, utshela umakhelwane kusazoba right, angithi. We are trying to motivate a person. Wathi omunye ke uma uthola umntwana usemncane usengavuka uyithatha uthole wesibili, I no, that is not the motivation I'm talking about. And then number four, then uthola ukuthi lo muntu usemotivated kodwa kanayi energy. Motivated, with motivation lo muntu angaya yofa angene weni. So we give energy by making sure ukuthi we journey with them, sihamba nabo, sihlale nabo, omunye uminvite ekhaya, you are trying ukuthi lo muntu umlekelele ukuthi exercise indaba yokuchannela positive energy to the right direction. And then okugcina sibanikeza ithemba. uNkulunkulu wasinikeza uJesu wambiza ngokuthi uyithemba lokulunga. So we give them Christ, we give them that hope. Wathi ke another guy from an Islam religion, wathi but you say you give them Christ and we tell them about Muhammad. Now we have learned ukuthi kulento faith-based organization we might look like divided uma sizibuka phansi, but when we pray to the same God. Kwenza ukuba sihlangane lapha phezulu njenge pyramid. Ngicela ukuthi ke program director ngidlulisa inselelo ethi abafundisi ke noma ama church leaders noma ama faith-based leaders, they are also people and they are emotional beings, nabo baya affectwa into ye mental health, your mental illness. But they provide usizo mahala because it is expected of them to provide ukuthi banikeze usizo mahala. Kodwa banayo bona indawo la beya khona bathola usizo lwamahala. You become a member of the community and you have to pay for all the services ukuze na usizakala. Yikho ke bona sibathola sebethatha intambo bayilengisa ngoba kanayo umuntu angaya kuye akhuluma avula isifuba sakhe. We pray and we beseech government to also provide for them so that nabo bakwazi ukuthi sebekwenze konke bakwazi ukuya la bezodibriefa khona so that they go back and be effective uma benikeza usizo. Thank you very much bahlobo bami, siyathemba ukuthi lolu sizo noma lolu lwazi liyohamba a longer distance. Thank you.
Sibonge Dumakude. Ngicela ukuqala ngicela ukuthi engathi umsindo ungangaba mningi uma kukhona okhulumayo kwipodium. Okokuqala, okwesibili ngicela ukuthi laba abafuna usizo la kutholakala khona usizo asimpela siyolufuna usizo kodwa ingathi singaba abaningi ngapha ukuze lokho engikushilo ngesikhathi ngikhuluma ngenhloso yanamhlanje eyokufundiswa nokufundiseka sizizwele engathi singaya nje as and when kukhona indlela yokuthi sifike sisizakale kulawa ama stalls la kutholakala khona ezempilo. Lo lesizo lizoba khona noma ngabe lo lihlelo seliphelile lizoqhubeka. Ngicela ukuthi okwamanje siconcentrate kakhulu la etendeni. Minister, ngesikhathi uminister nabahlonishwa bonke befike ekseni bekukhona abantu bakwa SAPS phakathi kwabo minister obeba leader owakwaShabalala. Uthe umefika minister wamkelwa uDr Shabalala kanti nami ngingokwashabalala bengithumela uDr Shabalala ukuthi amukele umuntu bonke nje abantu abafikayo njengoba ngiphethe lo hlelo nje ngokwashabalala njengamanje minister sebekhulumile abantu besha ama roles kuzokhulunywa ke manje ngendima noma ngengxenye edlalwa abelaphi bendabuko ngenzela ukuthi uma ngithi ngicela uDr Shabalala angathuki uminister into nje ekhona ekhaya Dr Shabalala
Program Director, ngibingelele Mshengi Shabalala, Dr. Mavuso. Ayizwe lethu singamakhosi vele. Ndaba ezitha usuyosixolela ngoba izwe lakho vele kodwa nathi lethu izwe. Singamaswazi siyabusa vele. Ngibingelele National Minister Dr. Joe Phahla Thobela Ntate. Luna mo KwaZulu Natal ri a hona bua Sepedi a ke re ntata wa nkushisa ngibingelele the former mayor yakudala la eNewcastle ubaba uDeputy Minister ubaba uDinangwe ubaba Dinangwe usebenze kakhulu nobaba wami ongizalayo we cancel yakhona la eNewcastle ngesikhathi esaphethe ngibingelele Advocate Majola the honorable mayor of Amajuba district uPrince uNdabuko Mageba siyathoba ndaba ezitha ngibingelele udistrict director Department of Health ngibingelele ama stakeholders wonke akhona abafundisi ama THP ama traditional health practitioners ekuyiwona ngiappoint ukuthi ngenze lo msebenzi wama THP ngaphansi kwaMajuba district ngibingelele uProf ubaba uqaleni qhamuke UKZN siyahlonipha Prof ngaphandle kokuchitha isikhathi program director minister deputy minister the honorable mayor thina singama traditional health practitioners kulomsebenzi okukhulunywa ngawo othinta indaba ka mental health we know exactly ukuthi kunama issues vele ahamba bese athinta abelaphi bendabuko bese kutholakala ingathi abelaphi bendabuko abaqeqeshekanga ukuthi bazi ukuthi i-mental health iyini. Fortunately Minister and Deputy Minister and Program Director thina singabelaphi bendabuko la eMajuba district we formed a structure collectively and we registered an institution based on training the traditional health practitioners in understanding about all social illnesses that affect our community. If I may quote, this year from the summit, the Minister of Health, Dr. Joe Phahla, have said to the THPs, there's no THP without THP. From that quoting, it came to my heart that I have a lot of work to do in my district in doing more research about our social illness, which was one of them, mental illness, whereby I took my THPs to private sectors whereby they were trained for basic counseling in understanding what is happening emzimbeni womuntu nasemqondweni womuntu ukuthi yiziphi inkinga umuntu asuke ebhekene nazo rather than ukuthi ukhuluma izinto zikamoya kuphela but kufanele ukuthi umuntu ukwazi ukuthi uma umbona esimeni esifana nalesi umnikeze counseling. Research that has been done, Minister and Deputy Minister, we found out that it's about 34.3% of the people sit in drug misuses, and that causes a problem. And about 18% is followed by 18.8% is followed by witchcraft. And 11.7% it is caused by genetic in family and relationships and socio-economic. So then, thina singama-THPs, through our studies and research, we found out that ukuthi not all patients of mental illness baloyiwe, akukho njalo. But kukhona ukuthi bayidinga psychological attendance and bayidinga futhi therapy. So through our research as traditional health practitioners, we've met with the Department of Social Development and Lifeline. We sat down, we talked about indaba ezithinta mental illness and what causes mental illness. Through that research that we have done with them, studying the problems that the people are facing up with, we found out that most of the people in the community, the problems that are facing up with indaba ye mental illness ikhozwa about indaba yomnotho kakhulukazi. And iyona nto eyenza ukuthi abantu bagcine beza nakithi singabelaphi bendabuko, uthola ukuthi umuntu ufika kithi uzoconsulta not knowing and not noticing ukuthi lo muntu loyo une problem psychologically. Uzodemanda ukuthi kwenzeke izinto miracle, but only to find out ukuthi there is a problem ethinta mental illness. So that thina singabelaphi bendabuko, we don't judge our patients, but we make sure that we give an understanding, because what causes nalezi zifo ezikhona ezithinta isifo sokuthinteka kwengqondo ukuthi zihlukene kangaki. We know that ukuthi there is a clinical depression and anxiety disorder and bipolar disorder. We as THPs, we are well trained for that through the assistance of the private sectors that have trained us. So then, siyazi ukuthi if a person udinga clinically, we then do a referral. Because I remember the time Dr. Dlomo was a minister, was the MEC for health in KwaZulu-Natal. Amajuba district was the first one to launch the referral system through Department of Health. And that referral was a one-way referral system, but it wasn't a two-way referral system. But now, Dr. Dlomo, we will like to say, as the traditional health practitioners now, we have our own specialists that have been trained under traditional health practice. Because why? There was a question that was asked by HOD, if I may quote him, the time during Kukala COVID. I remember we were there in the Truro House, go March, when COVID was hitting South Africa. He said to us, THP, why don't you stand on your own? Because your scope of practice, we do not understand it. So I then took it to myself at, okay, we should thina ma-THPs. Western medicine wants to understand if they can refer to us. What is it that we do? What is it that we are trained for? Because mawubona isangoma ubona nje isangoma nje kuphela. You don't know ukuthi lesi sangoma yini esikwazi ukuyenza yini esingakwazi ukuyenza. But now through e-help esithole nangu Professor Uqaleni, now we understand the scope of practice ukuthi thina singama THP asibona izifo zonke, but we know ukuthi we are specialists into certain diseases that can be helping also the department. So I've done my study work. And I've done my research with ama-THPs. Akhona amanye akhona esengiwatrainile mina through e-training nami engiyithole ku-Prof Uqaleni from the university. Ukuthi let me just extend my knowledge to ama-THPs ukuthi i-scope of practice between ama-THPs itself ukuthi Department of Health cannot do umsebenzi yena on their own ukuthi bas-train, but thina as ama-THPs yitho kufanele sizithuthukise ekutheni ukuthi u-Department of Health akwazi ukuthi as-understand, Minister, ukuthi what is it that actually that we are doing as ama-THPs. So kwi-scope of practice sinabo abantu abangama-specialists abakwaziyo ukuthi ba-identify ama-problems, especially ama-problems which are psychological, because even amongst ourselves bakhona aba-trained for those causes ukuthi bakwazi ukuthi ba-identify i-problem, ayi ukuthi umuntu sivele sithathe umuthi siyamshunqisela bese siyamphalazisa. We don't do that, but we start doing counseling and doing e-referral, and that is how we do it. I thank you for the moment that you've been given today, and I hope I'm looking forward to working together with the Department of Health, and I appreciate the time that I've been given.
Minister was going to say msheng, but now zoba ngazathi it's because when we see uTiti, but MEC, may I, before calling the next two speakers who are going to share their 10 minutes, 5 minutes each, acknowledge the presence of Professor Galeni from the discipline of traditional medicine in UKZN, Professor Zugi Swazingela, the Vice Chairperson of the MAC on Mental Health, Mental Act, Mr. Kabashe and Ms. Rowan Johnston, members of the MAC on Mental Health, Professor Luvuno, Center for Rural Health, Dr. I must apologize first. The surname here is G-U-O, so I don't want to spell it wrongly and say Gua or Hua. If I pronounce it wrongly, apologies. From UNICEF, Chief of Health and Nutrition. The next two speakers, Unobile Hlatshwayo no Asanda Mbonane. Ngicela beze bobabili bazoshare nje 5 minutes each. Wozani bobabili ngapha. These are the mental health care users perspective abazobe besinika yona Minister and MEC.
Sanibonani. Ninjani? Mina nginqobile Hlatshwayo. Ngizokhuluma ngamaphilisi asemental. Asesayikho. Ngiyengizwe kuthiwa labantu abaphuza amaphilisi abaphilile. Kanti akunjalo. Amaphilisi lawa siyawaphuza njengami ngiyawaphuza. Mangwaphuza ngaphuza ekuseni nasemini ntambama. Mele mawaphuza uvuke, ugeze, uxubhe, udle bese uyaphuza. Thu lapha awulali. Ungavumeli wona ungavumeli ukuthi ulale. Awulali bese kumenza noma yini ekhaya uphume uyekwenza ingadi. Utshale uqeda lapho ubuye ekhaya ubheke umsebenzi uwaphuze and futhi ngiyawathanda kakhulu and mangiwaphuza ngiyengizizwa ukuthi sengwaphatha ukuthi umngani wami umntanami asefana nomntanami kimi ekuseni mangivuka ngiyavuka ngixubhe ngigeze ngidle kodwa ukudla kwaphuza ngibona endlini okungcolile ngipoqe ngikline ngiphume ngiyokwenza ingadi ngenza ingadi ngibuye ngibona futhi ukuthi kuphi ekhaya bakhona iwashing ngithathe le washing ungalali ungavumeli ayalisana ukuthi ungavumeli wenza sure ukuthi uyasebenza umzimba uyawuvocavoca uzivocavoca uzuthi uyazivocavoca kakhulu. khadi. Leli khadi leli awulishiyi. Lihlezi lumngane wakho omkhulu kanye nawo amaphilisi akho lawa awengqondo awashiyi. Ahlezi ayinto enkulu kuwe awashiyi. Ngiyabonga kakhulu.
Greetings to everyone. Today I'll be sharing a personal experience my family and I faced at home. During this experience, it has been difficult not only for the one who's mentally ill, but for the whole family as well. My uncle has been mentally ill for about his entire life. We will feel hurt or embarrassed by him since it gets difficult to dictate his behavior, which we often do not understand. It gets way more hard when it comes to other people from the outside, most especially uneducated enough about mental illness. They have different opinions that affect him and make him feel different, and he became angry at everything most of the times. As kids, it hasn't been easy for us to accept it as a norm. Since his behavior changes from one angle to another, it takes a lot of adjustment to the emotion and stresses of loving our uncle. When it comes to finding help and support, this hospital has been very helpful by keeping him for some time as we see a huge difference and huge changes, well as communicating to the similarities with some of the community members who are in the same shoes but ill. But then, at the end of the day, mental illness often presents logistical challenges such as emotional stress. Because he is unemployed, it caused him to overthink, also sitting at home and not doing nothing. He feels less of himself. Since there is no financial support from us, sometimes as a family or from the government, so I urge the government to maybe build them a center where they will showcase their skills and be taught some of the new things. Even if it's 3 times a week, that will make a huge impact in his life. He will be looking forward to be doing something. We will love and appreciate more awareness to the people with mental health illness.
Siyaxabana ke lapha emuva Minister no Asanda njoba esalinda ukuzokhuluma ngithi mina igama lakhe uAsande uthi yena no yena wafunda eSt Michael's so igama lakhe uAsande. Minister, we are going to have a musical item from the Umgeni Specialized Psychiatric Hospital Mental Health Care Users Band. Yes. Can we give them a clap? You can go. representative from the World Health Organization, the country representative, Dr. Kalua. Sibamukele ngezandla.
Thank you very much, Director of Ceremonies, the Honorable Minister of Health, Joe Pahia, Honorable Deputy Minister of Health, Sibongiseni Dlomo, MEC for Health in KZN, Nomagusi Melane, Sandile Telezi, Director General of the Department of Health, Advocate E. Majora, Chairperson, South African Human Rights Commission, S. Shavarara, Head of Health, KwaZulu-Natal Province, Mental Health Practitioner Professional Associations, colleagues from the National Department of Health and the Provincial Department of Health, representatives from key stakeholder departments of health, colleagues from the UN and other development partners, colleagues from the Mental Health Civil Society, representative of Patients Association, ladies and gentlemen, and all protocols observe, good afternoon or good morning. I didn't check my watch. And welcome. And Sanibonani. Allow me, Honorable Minister, to start by thanking you, the Honorable Minister, and also thanking the Deputy Minister, the Mayor, the KZN MEC for Health, the Director General for Health, and other senior officials for gracing this commemoration. This is a clear testament of the importance you place on mental health and psychosocial well-being, which is highly applauded. The World Mental Health Day 2023 is an opportunity for people and communities to unite behind the theme that is mental health is a universal human right, and to improve knowledge, raise awareness, and drive actions that promote and protect everyone's mental health as a universal human right. Distinguished ladies and gentlemen, in line with the World Mental Health theme for this year, WHO has developed a tagline which says, "Our minds, our rights," to reaffirm the fact that good mental health is an integral part of our overall health and well-being. I am glad to note that for us here in South Africa, we dedicate the entire month of October, and not only October 10, the entire month to mental health awareness, with the objective of not only educating the public about mental health, but also to reduce the stigma and discrimination that people with mental illnesses are often subjected to. And may I suggest that we should take this beyond 1 month and dedicate the entire year, until next year when we have another theme, to dealing with mental health as a universal human right. Ladies and gentlemen, despite the universal nature and magnitude of mental ill health, the gap between demand for mental health services and the supply of mental health and psychosocial support services remains substantial. This has been occasioned by the poor investment in mental health and in non-communicable diseases in general, which is hugely disproportionate to the overall mental health and non-communicable disease prevention and treatment gap. Further, 80 to 90% of these disproportionately low budgets are allocated to large centralized mental health institutions, with less and less allocated to secondary and primary levels in the districts, and almost no allocation to the community-based mental health services. And this is the state in most of the countries, particularly the developing countries in the world. Where 1 in 8 people live with a mental health condition globally, access to mental health services remain unequal, with between 75% and 95% of people with mental disorders in low and middle income countries being unable to access the mental health services that they need. The barriers to accessing comprehensive mental health care include poor investment in mental health, leading to a lack of available services, poverty, stigma, violence, and discrimination. Some people with mental health conditions, especially from marginalized populations, can also face human rights violations like coercion, abuse, or neglect in care, and thus the need to enshrine access to mental health care as a basic human right. Having a mental health condition should never be a reason to deprive a person of their human rights or to exclude them from decisions about their own health. Ladies and gentlemen, WHO continues to work with the government and other partners to ensure mental health is valued, is promoted, and is protected, and that urgent action is taken so that everyone can exercise their human rights and access the quality mental health care that they need. Ladies and gentlemen, I am glad to note that the World Health Assembly and at the Regional Committee for Africa, WHO member states recently and overwhelmingly recognize that support for and commitment to quality mental health services might be scaled up at all levels as they endorse a comprehensive and integrated mental health action plan that extends to 2030. That includes an updated and revamped implementation plan and a framework with clear policy options and indicators. It focuses on four key areas, that is effective leadership and governance, and calling for member states to act on that as well as partners to support those actions. It looks also at comprehensive integrated services in community-based settings, include ensuring that partners do provide funding and support at all levels, but also ensure that these services are well integrated, available at community level, and are linked to other levels in terms of appropriate referrals. And also looks at strategies for promotion and prevention, including prevention of suicide. And finally, information systems, evidence, and research that is necessary to drive the actions that we take as we address mental health. These global and regional commitments are meant to ensure that our mental health services adhere to a human rights focus, are evidence-based, embrace life course and multi-sectoral approaches, meaningfully empower persons with lived experience or at risk of mental health conditions, and are an integral part of our universal health coverage efforts. Allow me to commend the National Department of Health, led by our Honorable Minister, for their efforts to incorporate comprehensive mental health services and psychosocial support within the universal health coverage mechanisms under the National Health Insurance. This will go a long way to reduce the mental health treatment gap, especially among the vulnerable population, the youth, and older persons. Distinguished ladies and gentlemen, within South Africa, the WHO continues to support the national and provincial departments of health with capacity building of primary healthcare workers on mental health using the WHO MHGAP tool that aims at decentralizing care for simple mental health cases to improve access to care and decongest specialized psychiatric facilities by sparing them of unnecessary referrals. Ladies and gentlemen, on this day, I call on more multi-sectoral efforts to address the social determinants and drivers of mental health in our country, as well as the resultant burden of depression, suicide, poverty, violence, and substance abuse. Further, as WHO, we call for meaningful investment in mental health, particularly in integrated community-based mental health services, because there is no health without mental health. Finally, Honorable Minister and distinguished ladies and gentlemen, on this World Mental Health Day 2023, I want to assure you of our continued support as WHO and as the UN in South Africa in improving access to mental health at all levels of care in the country as we move and as we work towards ensuring that mental health becomes indeed a universal human right in this country, in Africa, and globally. I thank you for your attention.
Thank you very much, Dr. Kalua. Cela simpinde ngezandla. I will ask now from the South African Human Rights Commission, Advocate Majola. Sicela uzosipha sezivumelene Minister about the minutes, and Prof, we know the number of minutes. And we said they are going to be secret between the two of us. Prof.
Mphathi wohlelo mshengu shabalala sidaba donga lamavuso sidaba sinothudla. Siyabonga. Ngibingelele abaphathi, ngibingelele uMinister Dr. Joe Phahla. Sihlonipheke kakhulu thina abalapha emadadeni ukuthi usivakashele. Sibingelele futhi nesekela lakhe uDr. Dlomo. Sithi sibonga kakhulu ukuthi nibumbane nibe nobabili ngoba ukusebenza sisonke kuyimpumelelo. Bese ngibingelela ebukhosini uMEC wezempilo lapha kwaZulu. Udadewethu uNomagugu Zulu. Bese ngibingelela futhi ke umphathi wendawo esinyathela kuyona u-executive mayor wamajuba municipality uNdabezitha osiye wasinikeza amagama akhaliphile kakhulu eqaleni kwalomcimbi. Ngicela ukuthi sibingelele nomnikazi walesibhedlela uCEO uMrs Khanyi nasebenza nabo sibonge ukuthi basivumele ukuthi sibe lapha. And to thank Dr. Owen Kalua from the World Health Organization and to say hello to him. I was quite impressed to see the member of the Mental Health Review Board. I would like also to say my respects to the academics, the professors who have been named here. One of them actually works with the South African Human Rights Commission, Dr. Zingela, and I'm very pleased that she is here. She supports us in our efforts on mental health. I would like to also greet the representatives and leaders of the faith-based organizations, the mental health care users, and all other leaders that are here. Ngiwumuntu wala emadadeni ke ngazalelwa la ngangilusela la isibhedlela singakabibikho. So isiZulu ngiyasazi ngasincelebeleni. Kodwa ngoba ke sineyivakashi inhlonipho engayifunda yathi makuneyivakashi boyiphatha kahle ungabe ukwetiza singabe sisazi ukuthi uthini. So ke ngicela ningivumele ukuthi ngikhulume ngesingisi. Honorable Minister, thank you for inviting the South African Human Rights Commission to be part of this event today. Let me also commend the Department of Health for taking the initiative to commemorate World Mental Health Day and for doing so through a community engagement like this one. It is very important if we are to deal with issues of mental health and the human rights of mental health care users that will involve the community. Mental health is an aspect of health care that has been neglected for a very long time. The fact that we are all here today to commemorate this day is an indication that we all recognize the importance of raising awareness on mental health, as well as the roles that we can play in improving access to mental health care for those who need it, including giving the dignity to mental health care users that has been denied to them for a very long time. Holding the commemoration among the community is an important step in involving the members of the community in the care of mental health care users. I grew up in a society that treated mental health in a different way, a way that said mental health care users are subhuman, that they lack dignity, that they were fair game for abuse with impunity. They were disrespected, insulted, subjected to violence, with or without reason, and often they were neglected by family and relatives, and sometimes some of them would be chained to posts or confined in some hut or deprived of their liberty in some other way. One can go on, of course, for a long time describing how mental health care users have suffered in the hands, especially of people who do not have problems of mental health and who should be protecting them. So the World Mental Health Day and the celebration thereof is a call to all of us, young and old, rich or poor, to understand and begin to treat mental health users in a different way, in a dignified and humane manner. This is because they also have human rights, and we must respect those rights. Our Bill of Rights states, for example, that everybody has inherent dignity. Everybody has the right to life. You can't just kill them. They have the right to freedom. You can't just lock them up in some hut or chain them to some tree. They have the right to freedom of security of person. Can't beat them up. They have the right to have access to health care, to sufficient food and water, to housing, and to many other rights that we have in our Constitution. And this includes mental health care users. We must highlight World Human Rights Day, not only this year, but where possible every year. I liked what Dr. Kalua said, that perhaps we should, like the human rights practitioners, say that not only just 21 March is a Human Rights Day, but the whole month is a Human Rights Month. That we should also say this is a mental health month, not just a day. I say this because all the rights bearers, the rights of mental health care users are the least respected. In fact, they are the most violated. This was the case under apartheid, unfortunately. It is still the case under our democratic dispensation. I am not saying that the exact way that they were treated then is still the same. Of course, there has been much improvement, but of course, our Constitution is unforgiving. It doesn't say that we should do a little bit more. It says everybody should have these rights. So we have to be working towards reaching that standard. So until 1977, and until the report of the Health Ombudsman, following the Life Esidimeni tragedy, in which 144 mental health care users lost their lives. Mental health care was more or less neglected. As a result of the Life as Stigma tragedy, the South African Human Rights Commission opened a national investigation and made hearings into the state of access to mental health in South Africa. We were astounded that so many mental health care users had perished while in the custody of people that were supposed to care for them. Life as Stigma made it clear to the Commission that access to mental health care required a special focus in our work. The mandate of the Commission comes from the Constitution of South Africa, and it is to promote the rights of everyone in the country and to promote the protection of those rights. We are also obliged by the Constitution to monitor and assess the observance of human rights in the country. We also have powers to investigate alleged human rights violations. Excuse me. The above mentioned investigation after the Stigma sought to hear testimony regarding all aspects of mental health in South Africa. In March 2019, the Commission released its report in which it made various findings and recommendations, and mainly to the Department of Health and to all the 9 provincial departments of health. Among those, it found that some of the human rights concerns and violations had happened because of the prolonged and systematic neglect of mental health at the level of policy and at the level of implementation. It also found that there was a serious lack of resourcing, lack of technical capacity, and even the lack of concern for the welfare of people with intellectual and psychological, social disabilities. The investigation also found that mental health care users were systematically excluded. The Commission found that there is a reason to suggest that the state's handling of mental health cannot be said to be reasonable in terms of the constitutional court standard setting, insofar as the progressive realization of economic and social rights is concerned. And this is the area where mental health care users are really lagging behind. A particularly vulnerable and marginalized group's inclusion in policy and resource allocation is a necessary condition for the state's actions to be considered reasonable and compatible with the maintenance of human rights of mental health care users. I must say that it is most encouraging to go around the country, visit hospitals, and see the work that is being done. I must say that the work is encouraging, but also at the same time, it also worrying, because you find that the resourcing of mental health care users, it still needs a lot that needs to be done. But there is encouraging work that has been done. The report also highlighted the absence of mental health review boards in some of the provinces at the time. In fact, I remember that when we interviewed some officials and we talked about the mental health review boards, some said they didn't understand what we were talking about. They didn't have the mental health review boards, even though it's mandatory to have them. So we have, therefore, as a commission, focused on the rights of mental health care users. We're focused on mental health as a subject, but also we're focused on mental health review boards, because in the recommendations that were sent to provinces, it was said to MECs that they have to appoint and capacitate them to make sure that they work, because they play a very important role in the lives of the mental health care users. So, Honorable Minister, it is encouraging to observe that the boards have been established and are operating. A few days ago, the Human Rights Commission visited Ladysmith Hospital following the abuse of mental health care users there, and the violation of his right to dignity. The Commission was pleasantly surprised to find the members of the Amajuba Mental Health Review Board there for the same reason. It gave me much hope that we are working together to protect the rights of mental health care users. Besides this incidental encounter with the Amajuba Mental Health Review Board, we have been actively engaging with the mental health review boards in some of the provinces, KZN being one of them, Limpopo being another one, Northwest and so on. Those we met were very enthusiastic about their work and acknowledged the importance of the work in the protection of the rights, the human rights of mental health care users. Yes, there are still some challenges affecting the functioning of these boards, which in turn, of course, affect their ability to offer their services to mental health care users. So I must say, however, Minister, Deputy Minister, MEC Smelane and DG Buthelezi, that the Commission has observed that they face many challenges, which range from capacitation of the boards, providing them with basic support needed by them to fulfill their mandate, such as the internet or clerical support. In one province, we discovered the perennial problem of the late payment of their stipends. In some instances, the vast geographical areas that they cover pose a challenge, considering that often it is just a few members that constitute the board. On this important day of the commemoration of World Mental Health Day, may I please request, Minister, that we pledge to work hard towards capacitating and strengthening these boards in the country. They are out there in the community. They are the link between mental health care users and the community, and now of late with us. They are the vanguard against the abuse of mental health care users and the violation of their rights. The role they play in promoting the human rights of mental health care users cannot be overemphasized. May I perhaps conclude by saying that during the investigation that I mentioned, we found that the stigmatization of people with psychosocial, intellectual disabilities is a key barrier to providing and receiving mental health care services. Stigma and discrimination in communities, in healthcare facilities, schools, institutions of higher education were also reported as a significant barrier to the inclusion of people living with intellectual and psychosocial disabilities. I plead with our communities that let us not discriminate against them. The member of the Mental Health Review Board said, "Singabacwasi." I'd like to second that. I'd like to say that is true. I remember the days in all these flats when we were herding cattle here that we had people that had psychosocial disabilities. Of course, we didn't know, and we thought that they were the toys with which to play. But looking back, I realized that it was because we didn't know. So it is important that we say and we let everybody know that nabonga bantu, nabonga bantu. Finally, may I thank you, Minister, Deputy Minister, MEC, DG, and heads of department for your cooperation in this event. I would like to say that the success of our efforts lies not in working in silos. It lies in working together. The Commission may sometimes be an irritation but it's for the benefit of these people who are very vulnerable. Some of them don't even know where they are. We have declared ourselves to be a human rights country, and we need to protect the most vulnerable by working together. The Commission remains ready to continue working with you and your department, and I'd like to say thank you because you have worked with us, and I hope that this will continue beyond today. I thank you.
MEC uthi Prof njoba esuke lapha uthi angithi I took 9 minutes. MEC ngesikhathi ngifunda emadadeni esekusile kwakunekhwaya eyayiwina nje ngangikule khwaya angiqedi nodaba lwami MEC usofonya lo wakomkhwanazi manifuna ukudoubt ukuthi yayiwina buzani kuye ngangihlala naye deskini bese siyocula naye uyeke manje ozoqhubeka nomsebenzi engamshiya nawo. Over to you, choir. They said they want to really sing before MEC stands here, so it's your opportunity. Choir, thank you.
Moya umama wazo siyamazi umelusi umama wazo ngithinguye noziwelayo nguye noziwelayo nguye noziwelayo nguye noziwelayo
May we ask our MEC, Umagutwa, Minister Simzwile, Advocate Majola, ethi ngwase madade. Nami ngithe ngwase madade. Dr. Dlomuno uthi athi akayeni wase madade. You can't be a mayor ungaseyeni wase madade. He was a mayor here. The MEC, uma ngathi ngiyekhaya manje, you won't finish 15 minutes engakafika ekhaya. Owala, MEC, it's your turn. Thank you.
Siyabonga kakhulu ku-Program Director uDr. Shabalala. Usesichazelile ukuthi yonke into enhle khona namhlanje ngaye. Abacula kahle uyena, abasebenza kahle uyena. Siyathemba ukuthi nokubi uzokuona ngelinye ilanga. Siyabonga kakhulu sibonge nokusiphathela uhlelo kahle eChudi. Ngicela ukubingelela ku-Minister uDokotela uJoe Phahla. Ngibingelele kusekela Minister uDokotela Sibongiseni Maxwell Ndlomo. Ngibingelele ku-Country Representative we-World Health Organization uDr. Owen Kaluwa. Siyabingelela Doctor. Sibingelele ku Advocate Majola owusihlalo we South African Human Rights Commission. Siyabingelela Chair, sibingelele u Director General wakwa Health ingane yendawo u Dr. Buthelezi, siyabingelela Sheng. Sibingelela u District Mayor osamukele ngamazwi amahle kakhulu Mageba, siyabingelela. Sibingelela amakhansela wonke. U Dr. SD Shabalala owusihlalo we Traditional Health Practitioners eMajuba District, siyabingelela kakhulu dokotela, siyakubonga nokusebenza kahle ndawonye. Professor Galeni from the University of KwaZulu-Natal, siyabingelela, thank you very much for coming. Minister, I also noticed as I was looking around that we don't only have a mental health board yala Majuba, but we have board members from other mental health boards. Thank you very much and thank you for coming. Siyacela ke ukubingelela ku department yakwa health iyonke, members of the media, distinguished guests, ladies and gentlemen, sanibonani. Sanibonani. Hayibo nganganizwa sanibonani. Uminister uzobuya kanjani menganibona ukuthi ngijabule? Sanibonani. Niyaphila. Oh, Minister, we have our own way of greeting. Hey, we have our own way of greeting. All right, akuphinde ngibingelele kahle. Sanibonani. Ninjani. So when I say sanibonani, response it is siphethe. Bese ngithi ninjani bathi yithi uhulumeni. Awu bese ngikhohlile ukuthi sesafundisana lo mcimbi ngaze ngajabula. Siyabonga kakhulu. Today we gather here at Tamadadeni Hospital on this very important occasion to commemorate the World Mental Health Day and to highlight and emphasize the critical importance of addressing mental health issues. For too long, mental health has been receiving the kind of attention, has not been receiving the kind of attention that it warrants. And I think we advocate Tuishilo Linda, especially given that it is such a common challenge in our society. In fact, according to the South African Depression and Anxiety Group, up to 1 in 3 South Africans suffer from some or other mental illnesses, while many have challenges with accessing the requisite level of care. So this should be a day when we not only seek to raise awareness about mental health, but also an opportunity to commit ourselves to actively advocating for mental well-being of all our citizens, as well as improved access to care. As I've indicated, KwaZulu-Natal, like many other provinces, face a high prevalence of mental health issues. Mental disorders such as depression, anxiety, and post-traumatic stress disorder are quite prevalent, and conditions like schizophrenia and bipolar disorder affect many individuals and their families. Alcohol and drug abuse are some of the risk factors that directly lead to the development of a number of substance-induced mental disorders, which can trigger symptoms of anxiety, depression, psychosis, and other mental health conditions in a person. Even drugs, which some may consider harmless or fashionable, such as dagga, and others that are more harmful and highly addictive, such as cocaine, niwunga, intash, are all known to have devastating effects on a person's mental health. Siyacela ukuthi indaba yensangu noma ukubhema kwensangu akufanele sikwenze kube into fashionable. Sibonile ukuthi kulamalanga sekukhona ngathi uma ngabe ungayibhemi insangu in one way or the other kusho ukuthi awuziboni izinto. Uma ngabe ungawathatha ama drugs in one way or the other kusho ukuthi awuhlakaniphile noma uyibhari lapho hleli khona. So siyacela ke ukuthi umphakathi wakithi wazi ukuthi ama drugs ayacontributor ezimeni zokuthi kube khona abagcina sebeyithola begula mentally. Uke wachaza ke usihlalo weboard lala eMajuba earlier on ukuthi even utshwala noma sikuthatha ngokuthi utshwala abunankinga, kodwa the fact that uthi uma usuphuzile ubusu uyadiya uyazela ungasakwazi ukuyicontrola kuyakutshela ukuthi kusho ukuthi khona impact obunayo emzimbeni wakho njengomuntu nasengqondweni. So konke lokho sifisa ukuthi sibambisene nomphakathi kube izinto esiyinakayo futhi kube izinto esiyigwemayo. We all need to remember that mental illness is not a choice, nor is it a reflection of a person's character. It is a medical condition that requires support, care, and treatment. Individuals who are psychotic should never be subjected to derogatory names or stigmatization. Abantu ke abagula ngokwengqondo thina emphakathini sesinakho ukubabiza ngamagama amaningana, abanye sibabize ngohlanyoni, abanye sithi uyantringa, omunye sithi unomdk. Now inkinga uma senze njalo senza ukuthi nalabo abagulayo abadingayo usizo bangakwazi ukuza bezosho ukuthi cha ngibona sengathi khona inkinga enginayo ngoba usaba istigma sokuthi umphakathi uzothini uma ngabe yena esenza njalo. Uma siqhubeka sifaka amagama noma sibabiza ngalamagama esiwashoyo senza ukuthi nalabo abazibonayo nabaziyo ukuthi baphuza amaphilisi bangakwazi ukuwaphuza bakhululeke ngoba besaba ukuthi thina njengomphakathi sizothini. Siyacela kakhulu emphakathini ukuthi asibambisane kulolu daba. Siyafisa futhi ukuthi njengoba sesilikalile uhlelo njengoprovince yaKwaZulu Natal Minister yokwazisa imphakathi ngama symptoms ahlukahlukene ukuthi umuntu ogulayo simbona kanjani. Siyafisa ukuthi imphakathi uthathe lolo lwazi ilisebenzise. Uyabona nje isibonelo thina sizwe simnyama ikakhulukazi uma kukhona umuntu omdala ugogo noma umkhulu one-dementia sivele sivuke emaphepheni sekuthiwa emadadeni kutholakala ugogo bethakatha watholakala ebusuku. Kanti inkinga ukuthi uvukile ebusuku mhlambe wafuna ukuya ekhishini noma wafuna ukuya endlini encane, uma seqedile ukuyikhulula uma sebuya ngenxa yesifo anaso akasakhumbula ukuthi kukuphi lapha kade ephume khona. Kanti uma singayazi lento siwumphakathi futhi singayithathi seriously yilapho esigcina sibona ogogo khona sebebulawa beshawa kube sengathi ubezothakatha. Asisho ukuthi abekho abathakathi, asizobaphika, kodwa asifuni ukuthi kube khona abantu abadala abalinyazwayo ngenxa yesimo abangakwazi ukusicontrola because bayagula. Siyafisa ke ukuthi sibambisane nomphakathi, amakhansela, babumeya, abaholi bonke abakhona ukuthi uma sikhipha le information, sikhipha ama symptoms okugula ngokuhlukahlukana kwawo, sikwazi ukuthi siwathathe lawo ma symptoms, siwaqoqe emakhaya, siwaqoqe emhlanganweni yethu ehlukahlukene, abasemabandleni bahambe bayokhuluma ngakho emabandleni ukuze njengesizwe sikwazi ukuthi sibe empowered, sikwazi ukumbona nomuntu odinga usizo lwethu ebese siyasondela ekutheni simsondeze emtholampilo ukuze ezokwazi ukuthi asizakale. Kufana nokuthi abantu abane depression bese sithi cha isifo sesingisi leso ngoba siyasisho njalo. I-depression ithathwa ngokuthi isifo sesingisi ebese umuntu noma depressed ngempela azagcina seyibulele kanti bengeke azayibulale uma ngabe ebesithathe serious akwazi ukuthi simsize thina sewumphakathi nemndeni. So ileyo request nje siyenzayo uminister ke uzobe sesixoxela ngakho konke okunye okukhona. Owami umsebenzi ubumncane nje kakhulu bona bekukwenza ama remarks bese ngi-introduce uminister. Uminister wethu ubaba uDr Joe Phahla oyimember yeParliamente le eCape Town erepresenta inhlangano African National Congress. Ubaba uPhahla une degree ebizwa ngokuthi i-Bachelor of Medicine and Bachelor of Surgery from University of Natal esiyaziwa ngokuthi KwaZulu Natal namhlanje ayithola ngo-1983. Wake wasebenza ke ezibhedlela eziningi la kwiprovince yaKwaZulu Natal include iPrince Mshiyeni Memorial Hospital, waphinde wasebenza naseGoli Gauteng province eMpumalanga naseLimpopo until 1994. Before i-adbanning ye-ANC ngo-1990 He served in leadership positions in various mass democratic movements, including ukuthi abe ilunga lesigungu esiphezulu senhlangano ebizwa ngokuthi oyayibizwa ngokuthi UDF, United Democratic Front. He became the first MEC for health and social development in Limpopo province after the first democratic elections in 1994. Emva kwalokho ke waseseva eyikhundleni eziningi zokuba ongqongqoshe kwi-province yaseLimpopo. Between 2014 and August 2021, uDr. Phahle besekhethwa ebekwa ukuthi abe yisekela likangqongqoshe wakwa-health ku-national. Ngo-5 August 2021, ubesebekwa ke ukuthi abe ungqongqoshe wezempilo eSouth Africa. Ngiyacela simshayele izandla bakwazi ukusukuma basukume ukuze simamukele uDr. Phahle ezokhuluma nathi. Siyabonga kakhulu. Over to you.
Siyabonga MEC, thank you very much. Thank you. Siyabonga kakhulu. MEC Simelane Nomagugu. Sibingelele uphathohlelo umshengu. Akuthishile ukuthi la namhlanje kuphethe omshengu. Sifanele sibingelele omshengu. Shabalala. Deputy Minister Udinangwe sebeshile ukuthi uke waba umeya la so sendaweni yakhe la eNewcastle umeya la meya uqala idemocracy. Our country representative for World Health Organization, Dr. Kalua, Professor
Okay, siyabonga. Let me start by thanking MEC and Nomshengu and the officials like KwaZulu Natal, and also from my own department, national. I'm sure I'm not the only one who's appreciating that we're really having a very grand occasion, namhlanje. Especially I'm really grateful, MEC. I'm aware that we didn't plan this in a very long time. It was a very short term. Just a few weeks ago, about 2 weeks, in a meeting, National Department. I was just coming back from an assignment by the President, where we are representing the country, UN. Amongst other topics, was the universal health coverage, of which primary health care is one of the main cornerstones of universal health coverage, and mental health is part and parcel of primary health. So when we're talking about world commemoration of World Mental Health Day, well, we are planning and so on, we are running late, and we are not sure that it can be done on the 10th of October. And I said to them, we still have 2 weeks. It can be done. Ngabazi abantu bakithi laphana osibali bami eKZN bahlala be ready osibali bahlala be ready. So Khulumani nabo, I'm sure we can do it. Ngabuza nje uShenge ukuthi awu sekukhulumile nomShengu na wathi hayi ngikhulumile nomShengu wathi hayi masiqhubeke. So I'm very happy, MEC and the team, that within that short space of time, we are here today to commemorate this very important day. As Uhlalo Human Rights and other speakers have mentioned, mental health has been neglected over many years and has not been profiled adequately. So it was important that we do this today. So I'm happy that we are here joining the community of the world. Ngoba is not South African Mental Health Day, World Mental Health Day, as derived by the by World Health Organization and its subsidiary body focusing on mental health. We are here to raise the profile of mental health, educate ourselves as communities, make sure that we can raise awareness of mental health, awareness of the signs and symptoms of mental illness, kumphakathi wonke, not just abantu abasebenza ezibhedlela from the health workers, but umphakathi wonke. And I'm very happy over sinabo our traditional healers, our ngqongqoshe ngenza iphutha basengibingelela abaholi ngakhohlwa hey ngizokhokha inkomo ngoba angishongo nje ukuthi ngiyabulela ku executive mayor Ndabezitha siyabulela sijabula kakhulu nje ukuthi nabo bakhona our traditional leaders, our councillors, because this is not just about health, it's about community and about society. So what we are here about, it's indeed very important. We are here also to encourage communities, employers, families, and public at large in the promotion of mental health, the rights of mental health users, and deal with the myths. Ushile MEC lana nje uthi ogogo basebegula ebusuku abanye sebecabanga ukuthi awu sebelahleka baphuma emakhaya bathi bayathakatha. So those are the kind of misinformations we must deal with today. Stigma and discrimination is still very a major issue, still rife in our communities, and it prevents people from coming forward. If umuntu mayiphethwe isifo sengqondo ibizwa ngala wonke lamagama, uzoya kanjani esibhedlela or uye umtholampilo mase ubizwa ngala magama? So stigma is a very important issue which we must deal with as we are commemorating this day today. And that's why we must intensify awareness campaigns to empower citizens and reduce this stigma which prevents people from seeking help. We know that at least 30% of people who suffer from mental illness don't actually come forward. Abantu abaphethe isifo sengqondo, up to 30% abaye kutholampilo. So this is an indictment on not just the health system, but on all of us as society. Lokho kusho ukuthi up to 70% abantu abaphethwe different ways of mental illness abaye kutholampilo. So what it means, bakithi ukuthi phakathi kwethu emphakathini kuma families bakhona abantu abaphethwe ile sifo sengqondo kodwa abasho, they are not coming forward ngoba basaba lezi stigma ukuthi siwabiza ngamagama. And some of the times, some of the people who have, as you've heard, there are different levels of mental unwellness or illness. And some of us are holding very serious positions, and masekuvela is stress, then we behave in a manner which surprises people. Kanti zonke lesikhathi bengihamba nje ngine stress esithize and mild depression, anxiety and so on. Kodwa mase kufika nje ipressure ethize, then I explode. People get surprised with awu senje wenze njani manje. So mental health is a very important topic which must be discussed in the communities, ekoleni, emsebenzini, and that's why we appreciate the theme of the World Health World Health Day to Mental Health today. Mental health is a universal human right, which reminding us as government, civil society, communities, and all stakeholders about the importance of mental health and the need to strengthen access for mental health services, so that people who experience any kind of mental illness must be able to come forward and receive treatment. Some few months, April, we had our first mental health conference. EGOLI, it's now EGOLI, the conference. Very important. In that conference, there were various people who participated, experts, practitioners, policy makers, nabantu abasebenzisa ama-services nabo bebekhona. There were a number of them who also addressed us on that conference. The one who stood up for me, which I still remember very much top of my head, a very popular musician, waziwa nje uSimpiwe Dana. Wakhuluma ngamnandi lapha wabeka nje own experience personal. Washo nje ukuthi naye unayo depression and kube nzima nje ukuthi ekhaya ngoba isifo esikhona ekhaya kubo, and wathola nje support from ifamily, and as a result uyayithola i-treatment. Washo nje ukuthi ngangibone ngicula nje entertaining people. Esinye isikhathi noma ngiyacula, I mean entertaining abantu, kanti nami nje khona nokucula lokho as I'm singing, I'm also taking out some of the frustrations through the music, but over and above that, I'm also getting treatment. So she was one of the high-profile people in that conference. So, and we believe that wherever we are, we must encourage, in the same way, MEC, that we have gone a long way in dealing with the stigma against HIV and AIDS, stigma against TB and others diseases. We must keep on, mobilizing and campaigning for people to understand and accept the fact that mental ill health is just like other illnesses. And if you have any doubt that you are not okay, you must seek help. Mental health was not really getting attention for many years. Namanje we're still struggling. Ikoni budget banayo. Nathi from national departments siyazama ukusebenza nama province silekelele la sikwazi khona ukulekelela ngama funds, because we know that we have other pressures like HIV, AIDS programs, TB, COVID. Leminyaka edlule sacindelelelwa i-COVID nayo sathatha wonke ama funds safaka ku-COVID ngoba it was the one which was killing many of our people. But we are aware that mental health is amongst in our country and in the continent of Africa and in many parts of the world is one of the top three amongst the burden of illness, the burden of disease in our society. Through a global burden of disease study which was done in 2019, which was adding on a finding by our own Medical Research Council in 2006. Mental health is actually amongst the top three. We see for in Africa. Neuropsychiatric conditions are third in the burden of disease in our country. Now, COVID nayo ya eda ngoba ngithi siyazi nje ukuthi kule minyaka edlule sahlushwa isifo lesi corona, sathatha abantu abaningi, our relatives, abanye baluza nemisebenzi, unemployment nayo seyanyuka, so ya eda nayo anxiety and other mental pressures on many people. So it's one of the things which have added. Okunye kufuna ukusho ukuthi mental illness ayinayo discrimination in terms of ukuthi umlungu noma umuntu. all across various races. Sifo sengqondo sikhona. And nakhona nje even amongst according to classes of society, noma ufundile, noma ufundanga, noma unayo imali, noma unayo, siyafika lesifo. So we must not discriminate. Mhlawumbe sicabanga ukuthi hayi isifo sengqondo nje sihlupha nje abahluphekayo cha. Nomuntu ofundile bakhona oprofessor nabo siyabaphatha lesifo, and people who are millionaires. So we must not judge people according to when they have a difficulty. Now, okunye okuhluphayo manje substance abuse. Ushilo MEC noma insangwa or cocaine, heroin, onke lama drugs. Onyawupe, inyawupe manje seyifike kakhulu. Akazi la KZN. Goli inyawupe seyiqeda ababasha. So many of our hospitals, casualty department, kugcwele abantu abasha because of lezinto nyawupe and all other substances. Now, to fight against this, health ngeke ikwazi nje ukuthi to fight against all this substance abuse. So kudinga nje the whole of society, abafundisi, traditional healers, amakhosi, we must all work together to fight against this poison. I'm happy to see Singana Lang Bonili with the subs in our desk lapana. So because we need to work together, all of us, to make sure that we can prevent, and also those who are already addicted to some of these drugs, make sure that they can be encouraged to come forward and get help. Any problem and is getting quite serious amongst young people is suicide. Who are already depression, so as teachers and as parents, we must recognize so mental illness, I challenge we must be able to akekho right. Bese siya-check-a nje ukuthi ingaba inkinga yini. Mhlambe esikoleni yabona nje abantwana sometimes even nasebedlala nje there are a lot of things that show you up, you know, and sometimes umntwana I feel discriminated. Bese bane depression. So that's why amongst the services esinazo, it's also for mental health yabantwana. So these are the things which we must be able, abazali nabo babe empowered. As part of community outreach, we must make sure that we empower parents. Now, no teacher la babone na ekolweni babone if umntwana obe active, say we change manje akasekho active, mabuza ama questions umntwana ujwayele ukuthi we answer very quickly. We must know there's something, and then they say we are interviewer and see what could be the problem. So as a result of this, we have also introduced programs which also help indicators for, especially amongst children, for a risk of suicide. So those programs have been rolled out, and our health workers have been trained in this program. We are already seeing that the numbers are rising. Just between April this year and up to August, there were already more than just under 80,000 people who have already been seen in health facilities with attempted suicide. And now like KZN numbers phezulu kakhulu, so these are things which we must be aware of. Now, as I've said, most of this can be handled by only health workers. So civil society leaders, faith-based organizations, traditional healers and leaders, we must all work together in dealing with this. We have made some progress. Ushilo Professor Advocate Majola, Chairperson of Human Rights Commission, would start shorter. We have made some strides. We have made some progress. A number of things have been addressed from primary healthcare level, we have developed programs such as the Adult Primary Healthcare Manual to help our primary healthcare practitioners to be able to be more empowered to identify early symptoms in the clinics. We are also providing medication in my clinic so that some of the early symptoms can even be treated in my clinic. So many of our clinics, they've already been trained in primary healthcare and primary mental health diagnosis. But after that, they also have also the powers to can start the early medication in my clinic so that so those are some of the progress which we have made. My community health workers now say our trainer mental health amongst other things about pregnancy or family planning or TB, HIV, what kind of relevant questions community outreach from the community health workers. So as part of also working, as I've said, working with all our colleagues in the provinces, seeing that my province, a lot of other pressures. No sugar, high blood pressure, and also my casualties. About getting even the issue of alcohol abuse problem in our communities. In our community, alcohol. I was a Friday. We are fewer. My clinic violence abantu balimele kuyagwazana kulamalanga kuyadujulwana. So ibhedlela zethu see under pressure with all these social ills. So as a result of that, because our facilities are under this pressure from national, masicele imali from the treasury, as a special grant to help in terms of mental health. So the treasury has imali 165 million. Le mali divide and share in our province. Ama psychiatrists, psychologists, or psychiatry nurses, and all other health professionals for is mental health. Up to just over 30 million of that in the province of KwaZulu-Natal, and I'm happy to say I-70 is a province, le mali. As a province, Wamanyama province, abanikeza le mali at the end of unyaka nje thola ukuthi imali yabuya abakwazi nje ukuthi get ama services kodwa hayi asinayo inkinga la eKwaZulu-Natal. Siyazama nje ukuthi ngoba not all our hospitals sinayo ama services we mental health kodwa we've got a program ezama ukuthi ibhedlela noma singezona ibhedlela ze mental health babe nama ward nama services akhona attached to every, especially regional hospitals. Kodwa la emadadeni it's a full-fledged psychiatric services. Sibonile ekseni more than 200 beds as active la. Kodwa ezinye indawo where they are not having full-fledged, now we are giving them all these grants so that they can establish ama section azokwazi nje ukuthi umuntu mayefika aphethwe isifo sengqondo bakwazi nje ukuthi bam attend. But we are aware that as chairperson where human rights advocate Majola says a lot of progress is being made, but there's still more which needs to be done. Sadinga siya shorta ngama professionals kakhulu o doctor specialize ngengqondo or psychiatrists, nama psychologists sisa shorta kodwa siyazama abaningi nje aba qualified bafuna nje edrobheni kuphela big towns o Durban abathola nje private practice kodwa siyazama nakhona nje ukuthi sibanikeze nama sessions so that even if abekho full time basilekelele nje mhlambe one day in a week babekhona so that we can be able to provide lama services. Ngibonga kakhulu MEC umama lo bekhona lana uphi manje umama uNqobile Hlatshwayo Oh, now, nentombazana Asanda, yeah. Uthi bazi la come and talk to us practical. Uthi kwenzekani? How is it helpful ukuthola treatment? No Asanda nje uthi ku family kunjani ma kunomuntu ophethwe ilesifo sengqondo. The kind of family pressures esinazo in the families. So sibonga kakhulu for them to be here bazokhuluma nathi namhlanje. So we must continue to make sure that we give voices to those who are actually having the experience of accessing our services. Ngoba thina singacabanga ukuthi hawu siyenza kahle kanti abantu abasebenzisa lama services wethu bona babona ngendlela, and they are the best people to give us advices. So I want to encourage the province and as in the next 2 days we'll be meeting now wonke ama MECs. We'll encourage them now ukuthi make sure that we engage abantu abasebenzisa ama services wethu. We are trying also to make sure that and I'm very happy MEC ukuthi ama board wala KZN akhona la, and ushile nosihlalo ukuthi wabonile ukuthi ayaphila ayasebenza, because we also want to make sure that lo msebenzi siwenzayo as a department we are working nomphakathi lama board are representing nina umphakathi to make sure that they can be able to see la senza khona amaphutha basibonise ukuthi hayi lana nje you are not doing the right thing. And we have tried, as Chairperson Eshile, after the experience your life is demanding, wonke ama province must have mental health boards so that they can be able to supervise on behalf of, because the mental health board represent various parts of a community. So siyawadinga ukuthi abe khona. As I move towards conclusion, Program Director, we are also working namanyamba department. At national level, we have an interdepartmental committee, also an interministerial committee with issues of improving services, mental health. The Department of Justice, Correctional Services, Namapoisa, Sevenza now, prosecution authorities, because as you know, even la Ematateni, we have also forensic mental health. Last 70 corner, the Justice Department. So I want to, as I conclude, tell all of us to be more caring in our communities. We must care about our members of our families, members of the communities who have any kind of challenges of mental health. Our clinicians and professionals can help, but for them to be able to help, but you would support and make sure that we make it easy for people to come forward and present to them, because they are trained, they are there to provide service. Mental health is the responsibility of all of us. It is part and parcel of the primary health, and not only health has got its own, as a department we have our own major responsibility, but we can only succeed to make sure that we can prevent and also reduce the impact of mental illness, especially the stigma, so that umuntu ophethwe isifo sengqondo amukeleke emphakathini and in the family actually is support. The World Health Organization defines health as a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. So, as part and parcel of the world, under the World Health Organization, I'm happy that we are here today to commit ourselves that indeed we are going forward, we are going to make sure that mental health is a flagship program which must receive all the attention from the leaders, from this community, and from all of us. Pambili, mental health, Pambili. Pambili, mental health, Pambili. Ngiyabonga mphathi wehlelo.
Thank you, Minister. We are now going to call on the Deputy Minister to do the vote of thanks. babembiza ngoBramex esemncane.
Uphethe namhlanje emshengu. Sanibonani. Ninjani? Oh, ngiyakuthanda lokushola la. Ngakithi kuyakuthiwa ukuthi njani bathi siyagula. Bathi lana siphethe. Ngizobingelela program director umshengu insizwa yendawo khona la emadadeni. Bese ngithi we all protocol observed minister ukuze ngikwazi ukubabonga bonke ngizoba babiza la ngamunye ngamunye. Sibonga umhlangano wabakhona minister between yourself no MEC uMagutshwa ukuthi nivume ukuthi lo mcimbi ube kwaZulu Natal buka indlela owathathwa ngayo wathathelwa phezulu kangaka sibonga kakhulu ivision uminister wathi lo mcimbi ufisa ube ngelanga layo imental health day in the world which is umhla ka 10 sibonge nalokho ukuthi uDG benomshengu ushenge nomshengu balalele ukuthi ufisa uminister lwenzeke lelanga namhlanje basebenze ngokusemandleni amakhulu siyababonga kakhulu uDG beno HOD besebenzisana neteam yonke yakwaZulu Natal o Dr Hongo nabo Mamuli Mweng abasuka eNational ukuthi lusuku lube yisuccess kangaka sibonga kakhulu lo msebenzi omhle kanjalo eniwenzile bese ngithi ke mntwana siyabonga ngikushayele ebusuku impela uthi awumuhle kahle kodwa sesibonga ukuthi uhlale nathi la kwaze kwaba ilesikhathi ngiyakubona ungena ngeinduku mhlambe sengibona ke angidlulisela ukuthi ukuhlonipha kwakho kuyasithobisa kakhulu naye uminister wethu lo uphuma ebukhosini wakaphahla so mhlambe kuyasiza laloko usithobisa kakhulu ukuthi uba uphakathi kwethu. We are always very appreciative when we have such events as government to see the WHO coming in and be part of. One party for them to support us by statements, but physically being with us, it really is humbling us because we are actually responding to the world call on issues of World Health Organization. Thank you very much, Dr. Kalua, for being here and for supporting always our events, Minister, when we are together like this. My other thanks go to Advocate Majola, and it is indeed, Advocate Majola, true that we have a very hard-working mental health review board in this province and in all districts. In fact, Mama Kumete, who seated there, I met her in Ladies Meet Hospital when your team was there also to come and investigate what was happening there. The team was already on the ground. So you are coming here again. It's giving us comfort to say, so you don't have to write us and say, what is happening there? You were there, you saw it, but our mental health review board, Abu Mam Kumete, were already on the ground, which is very humbling to see the leadership that is already on the ground doing the work. Mama Umzila, who was here talking about, talking as a member of mental health review board, sibongile amazwi akho nokusifundisa ubuse ususikhela kancane kulomsebenzi wakho emva ususifundise kakhulu ngokunye okwenzeka emakhaya ethu i-commitment kaPastor Dumakude mfowethu siyabonga your commitment and the support ebuholini bamabandla a faith-based organization is also very welcome and we thank you for coming in and giving us that support. Ndodana kababushabalala engisebenze naye kakhulu siyabonga kakhulu ukuthi usayibambile ngoba abantu bethu bayasidinga ngakho ke uqeqeshwa kwethu ngapha eWest niqeqeshe ngapha ngokwendabuko mesibambisene kanje abantu bethu boqhubekela baye phambili ngoba esikwenzayo sithi sidinge usizo sizo fisa kube khona lokho kusebenzeka okuqhubekayo no minister wethu uminister uPhahla is very appreciative of this relationship that we have with the traditional practitioners in this space. Professor Galeni, your ever available space to support us. Siyayibonga kakhulu kulo msebenzi. Ube bengakashadi bengizocela le team yasemngeni izocula lapha emshadweni wami. So ngoba it's us who understand and appreciate ukuthi you know we have our own gift. The gift that is there on that group of our mental care users is unique and none of us may ever be able to do it. Thank you very much for Umgeni Specialized Psychiatric Hospital team for supporting us.
ubese isikele ejika nje kodwa ungakhulumi kabo program director uzobuya uzovala emva kwakho hayi asithi njena wekhona njena elekelela amakhwaya kodwa yena ngowe voice hayi cha ngoba phela namakhwaya nawo administrator kubalekelela wayefika lapho ke strong kakhulu in being an administrator akaseculeni hayi mshengu ehlela ngezantsi mfowethu. Yeah, and we want also to thank the CEO, the WHO, for the bags that you have provided to the key leadership that is here. Thank you very much for that support. And some of the banners that we have, you came on to support us. Asivumeni ukuthi into enhle yangcono. CEO of this hospital, where is she? Ukhanya. Mina nje ngifike ngabona isibhedlela sakho ntatwethu si-clean kakhulu. A round of applause. And nginento nje ukuthi mesiclean kangaka lesibhedlela asiclean namhlanje phela hlale siclean futhi ukuba clean kwesibhedlela kusho nokuba clean kwemisebenzi eniyenza lana asayise niqhubeka mntanami niyenze lemisebenzi ibe mihle lesibhedlela all the time so that our citizens can always come and pray saying thank you very much to you. Sinibonge nonke ekade nikhona and all our leaders in various disciplines and all our healthcare workers abakhona and other sister departments that have showed their displays, SAPS, social development, education and all of them. Sinibonga nonke nifikile lana nokuthi sibonge iprovince yaKwaZulu-Natal isilekelele kangaka from national ivume lo mcimbi and ukusetshenziswa ngalendlela esetshenzwe ngayo sibonga kakhulu nibe nosuku oluhle. Thank you.
Siyabonga Dinangwe. Tawu I was taught ukuthi umuntu omdala umphenduli. Angizuphendula ke. Now I wanna get Tawu if he differs with you he stands a good chance yokuxoshwa emsebenzini. And I want to add Tawu, you know anyone who supervises uSandile is lucky. There is a supervisor kaSandile Shenge, but there is a supervisor kaSandile Shabalala. Just lucky. Sibonge Dinangwe. We want to ask Dinangwe and this table, you will stand here for a few minutes. We want to take a photo of yourselves. After that, you will then go back to where we did our briefing in the morning. But the other officials and guests that are here, you will go to the hall that is just nearby. You can walk to that hall. Umphakathi wonke sicela ukuthi nihlale nje la, then the program will continue. Ngike ngasho ukuthi the work enzekayo lapha izoqhubeka even after sekuphele lokhu. Kodwa okunye ngizocela ukuthi ngesikhathi bephuma abaholi bazoya njela ngaphandle mdu wena ozobathatha because they will have short interviews with the media. After that sobe sesihlukana. Ngizocela ukuthi that said sivale ngesikhathi sisakhula ke kwakuthiwa sesikuqedile siyabonga Nkosi ngezikhathi zonke osiphez. Amen. Manje nikula wrong lento. Uyabona khona la kufuke khona usithiosiphazona ukuthi igenge endala eyayikhona ibingaculi. Ladies and gentlemen, thank you for being the good audience. Siyabonga kakhulu. Sicela the photographers please come so that umholi bungeke kuthatha isikhathi eside waiting and we then continue with the programs of the day. Siyabonga kakhulu. Sandile. Yes, Sandile. No khona Sandile lo mncane.